Psychosis feels like you're losing your grip. Like being in a crowded room. Having so many things coming at you, voices, images, you can't sleep. I was homeless for about 3 years. I just felt like I couldn't do anything right. Not knowing how to do stuff that I used to know how to do. Going shopping, walking down the street. I felt like everyone was talking about me everywhere I went. Even going to check the mail was scary.
Psychosis is when an individual retreats into their own perceptions, their own thoughts, their own understanding of what's happening.
Some people see things that other people can't see. Some people will have really worried thoughts or feel like people are coming after them specifically.
Cognitive behavioral therapy can help them to start to break out of their cocoon. Our work at the Spirit Center is really about how we can train and prepare the workforce to provide culturally informed, trauma-informed, and empirically supported care. Our mental health system is doing the best it can with the limited funds that it has, but we need to do better. How do we help? How do we solve this problem? Traditionally, our medications have been on the front line, but our medications are not enough. Psychotherapy helps people learn about themselves, about what helps and what makes symptoms worse.
They had mentioned to me 2 times about taking CBTp, and at first I thought, I don't want to take anything like that, I don't want to be in group. But this seems to be more tailor fit for me. My therapist made me feel understood. They just asked me things that no one has really asked me about my voices. I didn't even know that I wasn't being honest with myself about my voices. It was eye-opening, and I don't think I would have been able to do that without the therapy.
Cognitive behavioral therapy for psychosis, it's different in that really you can meet people where they're at, regardless of where they're at in terms of their recovery. It's just very flexible, and it's really person-centered.
CBT has increased my confidence to talk to people, to walk down the street. I got so comfortable, I went and checked the mail in my socks. So I just felt at home in my own body. It really takes therapy to another level.
The data suggests CBT is one of the most effective and efficient treatments that we have.
I feel like I'm more effective with my client, and I feel like I'm able to measure their progress and see their progress. It's given people confidence in their ability to manage their symptoms, to see somebody do a 180 and all of a sudden be baking again, be traveling. It's amazing.
To be able to facilitate that kind of change. That is remarkably powerful to a clinician.
I feel much better equipped as a therapist having been trained in CBTp. They don't teach you how to treat individuals with psychosis in grad school. It was excellent working with the UW Spirit Center. Their training's really in depth. There's so much support, right? You always have somebody to go to if you have a question or if you're confused about something.
The mission of the Washington State Healthcare Authority is to provide access to health care for folks in the state of Washington.
The state has partnered with us since 2015 to train the workforce in cognitive behavioral therapy for psychosis. When we train clinicians, we ask them the question, do you have a clear sense of how to work with people with psychosis? And only 17% agree with that statement. By the end of our training, 95% of our trainees say that they have a clear sense of how to work with people with psychosis.
It's important that the state continue to fund workforce development, and we also need to support individuals in trainings for these types of evidence-based person-centered care models like CBTp.
We need systemic investments to help change the course for the millions of Americans who have psychotic disorders.
When we invest in the workforce, we invest in the health of the state.
I believe that it should be easier for people to get treatment in Washington State. We live with hearing voices, and it's scary. And I just want them to know that they're not alone. If you don't want to live like that, you don't have to. CBT has increased my confidence 100-fold. It's helped me in my life just being.